Okay, I'll just briefly show you how you access this set menu, and you change the setup of the machine. So if you want to take out a pulse current, for example, if you want to do an underarm treatment on a patient for the first time and you want to establish what's comfortable for them, we always recommend that you try the treatments in pulse current first, because it's the most efficient form of therapy, and then if the patient can't tolerate the direct current, or is any hypersensitivity or anything of that nature, you can then revert back to pulse current, which gives them milder treatments. But if you can try with direct current first, you'll probably see a better response. Okay, so we can only access the set menu just after turning the machine off and back on. The word set will appear for a few seconds, and each of these buttons have an icon that corresponds to the setup mode that you're in. So as you can see here, I'm going through the presets, so it's hand, foot, underarm and off. They're all off. Here's the pulse icon with the pulse light. I can turn it to P100, which is direct current, standard pulse current, and as you'll see as I scroll through, the pulse light turns on and off to tell you whether you're in pulse. If it's illuminated, that's in pulse current mode. If it's off, you're in direct current mode. When you're happy with your selection, just click enter. You'll see down here all 6 LEDs are off. This machine is now in direct current manual mode. We've got 15 minutes on the timer and 10 on the power. So if we're treating the underarms, what we suggest, instead of one 15-minute session, we bring the time down and you perform 2 8-minute sessions. And what that does is that allows you time to re-soak your underarm electrodes. If it's first time use, bring the power down as well to something quite low. And then when the patient's ready, and you've got the underarm electrodes hooked up, which are these, you just soak the leather sponges in water, in warm tap water, insert your electrodes, and then when the patient's ready, they places them under their armpits, and what will happen is the machine will register the circuits closed, the dive light's illuminated, and we're now powering up to the 5 volts that we told the machine to deliver. Okay, so that's the machine now set for 8 minutes with 5 volts on the power. What you want to do is obviously establish whether the patient's comfortable, and if everything's fine, you just want to slowly start to bring the power up. And you want to come up to the maximum comfortable level that the patient can tolerate. They'll be feeding back to you and telling you whether it's uncomfortable, what have you. So you'll know. And just sit there for the 8 minutes, and after the 8 minutes the machine will automatically power down. You can then re-soak your underarm sponges in warm tap water and do the same thing again. It will just remember what you do. Turn the machine off, turn it back on. It will remember the last settings you gave it. You can wait the 8 seconds, or you can just bypass it by clicking enter, and it will remember where you were. You wanted 8 and you had 10, and that's the power. And then as soon as the patient replaces the underarm pads, underarms, the dive light will illuminate and the treatment will begin.